Welcome back. Well, when we go to the doctor, we're usually the ones getting examined and not the other way around. That is, until now. Banner UMC South is gearing up to offer a very special opportunity to high school students of Tucson. And here to tell us about it are resident doctors Norman Beatty, Roberto Suazo, and Victoria Moraine. Welcome, everybody. Thanks for joining us.
Thanks for having us.
So it's going to be a really exciting event, it sounds like. Dr. Beatty, let's start with you. What else can you tell us about it?
Well, thanks, Alex. Thanks for having us. On April 11th from 5 to 7, we're inviting students from the Tucson area to come to our hospital and meet all the healthcare professionals who work in the hospital. And, you know, it's going to be an exciting event to allow these students to come and to learn more about careers in healthcare.
And what was it really, what was the impetus to putting on this event? What need did you see that you wanted to fill with this event?
Well, you know, it all started with some students who came in to visit some family members, and we had some wonderful conversations about my pathways becoming a doctor and their interest in, you know, going to med school. And, you know, on my way home from work that day, it just kind of had one of those aha moments. You know, we need to do this for our community.
Well, it's great when inspiration strikes like that, isn't it? And the fact is that high school students, at least certain ones, might be facing certain challenges when it comes to maybe their career path. So what are you seeing really that you want to sort of try to gap with an event like this?
Well, in coordinating this event, we've gone to several high schools here in Tucson and, you know, had the opportunity to speak to some of them. I think right now we really just need to stimulate them early in their life, you know, to have this pursuit in their mind that, hey, I might like healthcare. I might want to pursue a career, you know, helping others and being in a hospital setting or in a clinic setting. And, you know, this is why we're holding this event, so that we can bring them to the hospital and allow them to, you know, get this feel.
Well, and what better way to do it than to visit the people that are really doing this every day out on the front lines and really getting hands-on. So Dr. Suazo, what are the types of things that they're going to be able to do and interact with?
Yeah, I think kind of what Dr. Beatty was saying is that this is hopefully going to be a little bit different event than what you would normally see in a typical health fair. We're going to have really beautiful hands-on activities. So every respective healthcare profession is going to be able to have some of the tools of the trade that they use on a daily basis. So, for example, as physicians, we're going to be showing how we intubate a mannequin, you know, someone that's in respiratory distress. Some of the nurses will be showing how they start an IV line on the mannequins there. Respiratory therapists will show the mechanical ventilators of how they would, you know, treat someone that's having an asthma attack, things of that nature. So they'll be able to kind of work with the tools that they would potentially use if that's the health care field, I guess, that they decide to go down.
That is so cool. You know, even if they do choose that later on in life, they're going to think back to when they did this and they really had the hands-on experience with it.
Absolutely.
And just the incredible experience that they could have. So for people who may not know, what is an intern, what is a resident when it comes to the medical fields?
So in terms of medicine in general, once you choose that you want to go into the medical field, you go through your typical 4 years of medical school, right? And from there, you kind of decide on what field you want to focus on. So for example, Dr. Beatty and I are from internal medicine, but you can go into family medicine, psychiatry, emergency medicine, etc. And that's known as residency. So you're a physician, but you're also in training. So you want to make sure that you're being supervised by an attending physician, whether it's direct or indirect supervision. So an intern is someone that's in their first year of residency, and a resident is someone that's in their second or beyond.
Okay, very good to know. And this is information, of course, that they'll learn farther along in their career, but they have to start somewhere, and this is a great event to do that. So Dr. Moraine, let's dive a little more into who trains these residents.
Absolutely. So, as said by Dr. Suazo, after medical school, a student applies for training in a particular specialty. These two guys are internal medicine residents. They have chosen that specialty. They're trained by physicians who have already completed all of their education and are now senior faculty in that particular specialty. They will teach them all of the ambulatory as well as hospital-based training in that specialty. I'm a family physician and I'm a faculty in the Department of Family Medicine. And so I help to train residents as well as students in family medicine. Depending on the specialty, there's a whole breadth of experiences that the residents will have.
Okay, and so for somebody who may not know, what does a typical day for a resident look like?
Great question. So actually, depending on whether the resident is in an outpatient or an inpatient experience, dictates the day. If they're doing an inpatient experience, their day probably starts about 4 or 5 in the morning, getting acquainted with the patients of the day, what the plans for the day are, talking with the supervising attending and determining who's going home, who's staying, who's being admitted for the day, needs to be in the hospital. If they're in an outpatient experience, they actually are spending their time managing patients and helping them implement the care that will keep them out of the hospital, hopefully. Now, the residents who are in the hospital also cover the night. And so, although those who are not in the hospital that day will leave at the end of the day, someone has to be there at night to make sure that the patients are cared for.
Wow. Well, I feel like you've brought a little mini career fair right here, because I'm learning a lot about you guys and about everything you do as doctors, and it's really impressive. So if somebody wants to make it out to this event, do they have to get tickets? Do they have to sign up? What do they have to do?
Well, we have several ways to RSVP, and the spots are limited right now, but we want to give all the students here in Tucson the opportunity to come. It's going to be a very unique experience. So they can either call our office, 874-2995. They can also email im.residency@bannerhealth.com, or they can talk to their high school guidance counselor. Most of them in Tucson, most of the high schools are aware of the event.
Excellent. Well, it's great to talk to the doctors that are keeping us healthy now, and then in the future, the kids that are going to attend this event are going to keep us healthy in the future. So I want to thank you guys so much for joining us today.
Thanks,
Thank
Alex.
Thanks for having us.
Appreciate it.
Now, guys, the career fair will take place April 11th from 5 to 7 p.m. at Banner UMC South. And to learn more, call 874-2995 or send an email to imresidency@bannerhealth.com.